So this was a separate study that I was involved with where we were looking at the real-world outcomes of patients receiving intensified therapy. Now, because this is the Concert AI database that we retrieved this information from, we were also able, with our sort of denominator, to determine all of the patients that were treated. And so this gave us, first of all, a look into how many patients over this more recent time snap were receiving monotherapy versus intensified therapy. And unfortunately, it's still disturbing to me that there's a significant number of patients receiving ADT monotherapy. Clearly, there are some patients that that's a reasonable choice for, but it should be a very small proportion of the total number of patients that are treated. And in this study, what we found is that total was about 15%. Which is still, I would argue, far too high than what it should be, given the comparable quality of life outcomes for all of these intensified therapies compared to ADT monotherapy, for the dramatic improvement in oncologic outcomes. So again, I would argue that 15% is still too high. So that was one of the important findings for me that we found with this. And then second, of those patients that received intensified therapy, we were able to compare the PSA metrics between them. Now, I will say, because of the limitations of the database, there's some important disease characteristics we weren't able to collect and therefore account for that we know are prognostic. For instance, the volume of disease, right? Do they have charted high volume versus charted low volume? What was their Gleason score? A lot of these things are very important prognostic features that in and of themselves can impact the outcomes that we measured. That being said, what we found is that across all of the intensified therapies, they were all significantly better than ADT monotherapy, which is, again, reassuring and expected based on the published prospective data sets. And then secondly, what we found is that the ADT plus NHT, or novel hormonal therapy combinations, all performed admirably well. We happen to find in this data set that Apalutamide seemed to be particularly effective and led to the longest, clinical or disease control as measured by PSA metrics. So again, which is reassuring because this is a well-tolerated therapy. It's again, as we demonstrated in conjunction with the Titan trial, which was the prospective phase 3 trial, it's a very potent and effective combination. So to me, what is the importance of this data? It really just further demonstrates that these combination therapies are potent, effective, and these are what should be the standard of care that we're offering to all the patients. And again, if you choose to use ADT plus Apalutamide, I think that's wonderful. It's an effective combination, but we really need to be getting more of our patients on these combination therapies.